Welcome to Beyond the Balance Sheet, the podcast that helps advisors, clinical professionals, and affluent families understand the complexities of issues related to our mental, physical, and emotional well-being. Our co-hosts, Arden O'Connor and Diana Clark, will interview a series of guests on a range of topics, providing informative content and practical tools for professionals and families to consider. Here are your hosts, Arden and Diana.
Hi, and welcome to an episode of Beyond the Balance Sheet. Today's guest is Dr. Jason Schiffman. He is a medical doctor who is the founder and director of the Camden Center, which is a very sophisticated, very out of the box, I will say, program that addresses the struggles of those with substance use and co-occurring disorders. And his expertise comes both as a medical doctor and with a master's in business administration in psychiatry from UCLA. He has served as the chief resident at UCLA for anxiety disorders programming, and he brings that to his work. And more than that, he is a really interesting guest. So thank you today for coming, Dr. Schiffman. Can I call you Jason?
Please do, and thank you for having me.
You're welcome. So first question, your center, the Camden Center, is located in both LA and in San Francisco, correct?
That is correct, yes.
So in your LA program, my understanding is you have pretty high profile clients, you have some celebrities, you have people who on an average day, other people might know their names. Is that right?
Yeah, I would not say that they are the majority of the patients that we treat, but they definitely constitute a certain percentage of our patient population. And I think that is just a consequence of the fact that by virtue of being in Los Angeles, we're kind of at the epicenter of the entertainment industry. So we do tend to have a fair number of celebrities that we treat. And, that patient population comes with certain challenges.
Well, that's really what I wanted to ask. Before we go anywhere else, do celebrities struggle differently than the rest of us?
I don't think they struggle differently than the rest of us. I think, to be honest with you, they struggle almost exactly the same as the rest of us. And to the extent that they are in the public eye and have access to things that celebrity affords them, I think actually to some degree that makes it actually a little bit more challenging for them to recover. It's not insurmountable, but I think to answer your question, the origins and the processes that result in all of us who develop mental health or addictive disorders, those are the same processes that are there for folks.
I mean, like family of origin, other diagnosis, neural wiring, temperament, trauma, all of those things actually happen to celebrities too, huh?
Yeah, and in fact, actually, I would even go a step further and say that for most individuals that end up becoming successful in the entertainment industry, the drive that has enabled them to become successful in the entertainment industry actually also has its origins, or has the same origin as the thing that leads to depression, anxiety, and substance use.
So the driver that helps them develop fame is the very same driver that may actually create the struggle.
That's right. And to me, what that is essentially some experience of developmental trauma, that results in there was a psychoanalyst called Michael Balint who talked about this idea of there being a basic fault, which is sort of the thing that all children make up about themselves if there's a loss of attachment or problems with attachment. That it may be a false narrative that they create, but it's this idea of what was wrong with me, that I was insufficiently lovable in order for the attachment to my caregivers to be maintained, or attachment to my peers. Of course, we all have some degree of this. And to the extent that the shame associated with that basic fault becomes a predominant component of our sense of self, we become driven to do things to make the pain of that go away. And those things can be drugs, alcohol, affirmation from other people. And that's the connection, I think, to the drive that can lead people to have a sufficient amount of work ethic and drive to become famous, and also the same thing that can drive them to develop shame-related emotions like depression and anxiety, and then seek out ways of numbing that out through drugs, alcohol, food, etc.
Of course. Question, is image management a real barrier for some celebrities to get the help they actually need? Or would you say that the culture is such that it promotes that kind of help?
It's a really good question. I think that the landscape is changing. So I think that even just 5-10 years ago, there was still enough stigma associated with mental health problems and addiction that the vast majority of people in the public eye would be very careful if they did seek out treatment to make sure that that fact was kept out of public awareness. I do see that there is a shifting landscape now. I think that there have fortunately been enough celebrities that have sort of come out openly about their own struggles with mental health and addiction, that the stigma both for other celebrities and for the population in general is decreasing. I think it's a little bit of a double-edged sword. I think because sometimes, when someone who is in the public eye comes out as being in recovery, that process can sort of be co-opted by that same sort of affirmation-seeking drive that they have, and then their being in recovery sort of becomes part of their image, and then that becomes an actual struggle for them to authentically heal the sense of self-related issues that need to get addressed.
That's true. I can see how that would happen. Do you have a celebrity in mind that has come out, not one you've necessarily treated, but in the mental health space and really owned their struggle that has been helpful for other people? Do you have one of those people that you think of?
I do think that fortunately, and particularly recently, there have just been a lot of celebrities doing what I consider to be a very significant and important public service by being open about their own struggles with addiction and mental health, which, again, I think pulls these issues that are pervasive in our culture much more into the light and makes them viewed less as things to hide and be ashamed of, and more just conceptualized as other health care problems, in the same way that we would look at, diabetes or other, more biologically based problems.
I like it.
So
Question.
Avoiding that question.
Yeah, now that was a good answer. I can think of, I watch my news feed and I see celebrities, and not just celebrities, people with higher profile names coming out and talking about the struggles in their family and struggles with themselves. And it makes me feel like we are making progress as a culture. So I see that as helpful. Question I have, for somebody, whether it's a celebrity, high profile client, person of wealth, often they are surrounded by or have a staff of people. We can call them the support staff. We can call them the bit players. We can call them the entourage. But in those systems, because those must be akin to a family system that I think of when I think of, are they helpful or do they actually hinder mental health?
Yeah, well, I think that you get examples across the spectrum. I think that for many individuals that are in the public eye, and actually I don't know that this necessarily applies only to people who are successful in the entertainment industry. I think this probably is also the case for anyone for whom the people that work for them may have incentives that aren't necessarily aligned with what's in the best interest of the individual. And I think, I think that happens very frequently for individuals in the entertainment industry, where those around them have their material or financial well-being tied to supporting elements of the celebrity that maybe are not particularly helpful in terms of their mental health or recovery in other ways. So it is often a problem. But the other thing that I have often found is that there's usually at least a few people for everyone who really authentically care about that person and are in a position to really actually help support them do what's in their best interest. And those are usually the individuals within the system that you want to sort of home in on and identify and then use as allies.
I would imagine, I mean, when I work with a family, my goal is always to get the system healthy as well as the individual. I would think that in these systems, and I've worked with some of them where there is a support staff in the mix, to do some real work with them to be able to educate, support them to do work which promotes mental health and not just comfort. I think
that's absolutely right. And I think what's also difficult is, most people who use, for example, who use drugs or alcohol is a drug. So most people who use drugs don't end up having a problem with them, right? The vast majority of people who drink alcohol don't become alcoholics. The vast majority of people who use cannabis products don't become cannabis addicts. The vast majority of people who are prescribed or take benzodiazepines don't develop a problem with them. And so, every one of us interprets the world through the lens of our own experience. And I do think that a lot of times what's difficult for people within the inner circle of somebody who has an addiction, whether they're famous or not, to understand is that that person's relationship to their substance use can be very, very different than the other individual's relationship to substance use. It's very difficult for somebody who has never experienced an addiction to understand how someone with an addiction could make decisions about their use of that substance that would be so fundamentally detrimental to their own best interests. And so I think that often is one of the problems. It's not necessarily always that, you have these hangers-ons that are nefarious and only acting in their own best interest. I think it is also just a consequence of the fact that for most people, their relationship with the substance does not involve an addictive relationship to that. And so they project their own relationship and their own understanding about that substance or that behavior onto, the patients. And unfortunately, there's a huge difference between having an addictive relationship to a substance or behavior and having a non-addictive relationship to it.
Right. I can see what you're saying. And somebody's out with somebody and says, come on, tonight you're just going to have 2. You're going to prove to yourself that you don't need more than 2. I could see that happening. Yeah.
Yeah, that's right. And I also think that to some degree, the historical trajectory of cannabis legalization in the country, took this sort of weird detour through medical cannabis. And I think there's a generation of people who were exposed to information about sort of the medicinal benefits or the how benign cannabis can be that was actually an overreaction to the misinformation about cannabis that was sort of put out by the government prior to that, right? So we sort of were on this pendulum swing from when I was growing up, cannabis products which was essentially just marijuana back then, was put in the same bucket as cocaine and heroin as this terrible drug. This is your brain on drugs. And there was no difference made between much more dangerous drugs and cannabis. And so I think that what ended up happening in the trajectory of legalization, which we're still on, is that there was sort of this counter position that was taken of, look, cannabis is completely benign. It's a panacea. It's good for gout. It's good for anxiety. It's good for insomnia. It's good for everything. And it's completely harmless. And that's also not true. The reality about cannabis is that, it absolutely from a toxicity standpoint is probably one of the least harmful drugs that people do. But there are risks associated with it. And just like people can become alcoholics, but most people don't, people can absolutely become cannabis addicts, even though most people don't.
That makes sense. So you run a treatment program that is a little bit different, but you still use some group work at the Camden Center. Is that correct?
Yeah, absolutely. At Camden, actually, I think the thing that makes us unique is that we don't have any set tracks or programs. So every patient has a unique team that works with them. And so some people are all in all individual treatment. Some people have groups, but the decision about what treatment modalities they're participating in is just made clinically. So it's whatever each person needs.
That's helpful. So tell me, do you find that somebody in a high profile position in the world has a difficult time? I mean, not just one. I'm thinking about people, but some will do fine, some will not. But in general, that urge to be special, to be seen, to be big, does that actually become a problem when they're actually in treatment?
It's interesting. I find that there is a problem related to having celebrities in group therapy, but it's not that. It's not usually
Okay.
it's not usually that they're so narcissistic that they just need to, and that they take over the group and that they just need adoration. And in fact, it's often quite the opposite. It's usually they have a desire to actually be within a group setting and are either realistically or unrealistically sort of prohibited from doing so because they worry about the exposure. If they're, if it's a secret that they're in treatment, then obviously putting them in groups is problematic. And I think the other issue as well has mostly to do with the response of the other group members, right? So, and this is something that is absolutely not an insurmountable problem, but it is a challenge, and it's something that can be managed in better ways or worse ways. But oftentimes putting a celebrity in a group therapy session can cause problems in terms of the dynamic between that person and the other group members. Either the other group members feel inhibited from being completely open and honest, or they become starstruck, or there is a feeling on the part of the celebrity that they can't really just be their authentic selves because everybody's interacting with them via their image. So it is a challenge. But again, I think that the issue is less about sort of typically less about a feeling of entitlement and not wanting to sort of be amongst the commoners, I guess. That's not usually the issue. It's usually other challenges. But you're right in identifying that group therapy can be a very vital component of recovery, particularly from addiction. And there are challenges that are associated with that when somebody's famous. Fortunately, in Los Angeles, I think almost everyone in the entertainment industry is either in active addiction or in recovery. So, so fortunately in Los Angeles, I mean, obviously that's an overstatement, but there are quite a few 12-step meetings within the Los Angeles area that are private meetings where people with special privacy needs, can have those accommodated. What is also interesting, though, is that, what usually ends up happening is that once people are really much better and healed, they tend to just sort of go to regular meetings and show up and be less preoccupied with sort of what the consequences are of being seen. So
that's great. That's great.
Yeah.
So I am an old fan of a show on public radio called Car Talk. And at the end of Car Talk, they used to close the podcast with, "You've wasted another half an hour talking to us." But I don't feel like I feel like we have had this amazing half an hour listening to you and talking with you. Tell me if you were going to leave this audience with one thing, what would it be today?
The core of what we're trying to do in mental health care is to bring people to a state or place that is actually just a place of health and balance. And it has to do with giving people the core belief, the axiomatic belief, meaning belief without proof, that they are fundamentally a valid, lovable, good person. And that goes whether the person's famous or not famous, or tall or short, or fat or thin, or whatever. Ultimately, with the exception of the more neurologically mediated mental health conditions like schizophrenia or bipolar disorder, which are, those are hardware problems. Those are problems where the brain, the organ of the brain isn't functioning well. But for pretty much all of the other mental health conditions and the problems that come from the dysfunctional coping mechanisms that we use to manage those conditions, at the core of what's there is essentially a sense of self where there's a belief that there's something, a basic fault that makes us essentially unlovable or invalid, and ultimately, even though people present for treatment because of these crises that unfold, really the true work that is needing to be done underneath all of that is getting down to what is that person's core belief about themselves, and how do we help people learn the skill of treating themselves the way a healthy, loving parent treats their child, which is to love them just because of who they are, not because of what they do or because of what they don't do, right? Like a healthy, loving parent, doesn't wait to see if their kid's good at piano or becomes a doctor to decide whether they love them or not, right? And they don't stop loving them just because they did something wrong, right? So that to me, I think is not just for this podcast, but to me, that feels like the most important message in terms of, what is it that we're trying to do in mental health care? What ultimately is the mechanism of healing that is behind or underneath how people recover from these things that lead to the crises that make them present for treatment.
I would imagine that when somebody has that internal sense of I am valuable, I am lovable, all of those things, they then have the capacity to be authentic. Is that right?
Yeah, that's right. I mean, I think fundamentally, what it means to be not authentic derives from the sense that there's something embarrassing, shameful, or wrong with me. And therefore, in order to fix that or protect myself from being judged for that flaw, I need to do or be something different. And it's, I think fundamentally there is a vulnerability to just being who you are. And I think, if you get sort of good enough parenting and stable enough attachment growing up, you get enough of that validation to be comfortable in that vulnerability. But for a lot of us, if there was beneath the threshold amount of validation and attachment security that we needed, then we walk around kind of constantly vigilant about being exposed for and seen for being flawed or bad. And that's fundamentally, again, like I said, whether you're famous or not, or whether no matter who you are, that's ultimately, I think, what is the foundation of emotional well-being, is to be able to get to that space. So.
I love that. Thank you, Dr. Schiffman. Appreciate you joining us today. You have spent this last half an hour listening to Beyond the Balance Sheet podcast, or even watching if you've been on video. If you have enjoyed this, please like us on your platform of choice, and we look forward to listening next week.
Thank you for listening to Beyond the Balance Sheet, a podcast designed to help advisors, clinical professionals, and affluent families solve some of their biggest medical, psychiatric, and emotional challenges. Visit beyondthebalancesheet.com to read more about our guests and resources, and sign up for our newsletter.